Quick. You have a pediatric patient, they're apneic. You're going to ventilate him. How fast? Should know that, right? Or you've got a patient in cardiac arrest with an advanced airway, regardless of the age. They're doing CPR. How often should you ventilate? Should know that really quickly too. Here's some easy ways to remember this stuff, right? So with rescue breathing, these are American Heart Association numbers. So, and we was thinking seconds, one breath every X amount of seconds as opposed to breaths per minute. We don't think in those terms. I hate when you see BPM. So we're gonna give one breath for infants and children, one breath every 3 to 5 seconds, okay? And for adults, it's one breath every 5 to 6 seconds. Guess what? There's a 5 in there for everybody, man. So let's go 5 alive. If the patient's not breathing, they're apneic, we're gonna give one breath every 5 seconds just to chest rise. Cool, nailed it. You don't have to worry about that. Just want 5 alive. Now, if we have a patient in cardiac arrest and we're doing CPR on that patient, we always want to get an advanced airway in fairly quickly so we don't have to interrupt our CPR. We can do continuous compressions. And as we're doing CPR with this advanced airway, we're going to give one breath every 6 to 8 seconds. Now, I've already talked about in another video how we overventilate, and that causes a problem. It drops blood pressure, especially with CPR. So we don't want to overventilate these patients in cardiac arrest. So we just want to ventilate the chest rise, and it's one breath every 6 to 8 seconds. We have a tendency to go too fast, though. So let's say 8 Pearly gait for our dead patient in cardiac arrest with that advanced airway. You know what that means, though? That means just 2 numbers to remember. 5 alive, rescue breathing, 8 Pearly gait, cardiac arrest patient with an advanced airway. Boom, make it simple.